identified in a 10-month-old baby. UN officials said they're making progress, having reached more than half of the children needing the vaccination. Well, for more on that vaccination drive, we can speak now to the Deputy Director of UNRWA, Sam Rose, who's in Khan Yunis. Sam, thank you very much for joining us on BBC News. So tell us a little bit more about the challenges facing you as you attempt to continue this vaccination drive.
Absolutely. Thanks for having me on. I mean, we were successful, we believe, so far in the middle area of Gaza initially, then the southern area of Gaza next. We've now got teams moving up to the northern part of the Gaza Strip. And this is essentially, or by far, the most difficult part of what has already been a very complex campaign, given the environment up in the north, the level of destruction, the level of displacement, and essentially our isolation from many of the large portions of the population in northern Gaza for the past 11 months now. So teams are on the way as I speak. Vaccinations have already reached northern Gaza, and all going well, that campaign will start in northern Gaza tomorrow.
Just remind us about the impacts of polio if children aren't vaccinated against this disease, because as we explained in the introduction, it's been 25 years before this case was identified in a 10-month-old baby. It's been 25 years since polio was identified in the area.
Yeah, I mean, the consequences can be devastating. Polio doesn't kill. It rarely kills. I think about 5% of children that contract polio will die, but it's not the death. It's a lifelong implications in terms of paralysis, in terms of loss of movement, in terms of muscle deterioration and things of that nature. And polio, we believe, has reemerged in Gaza as a direct result of the conditions that people are living in, the devastation to the health sector, the poor sewage, sanitation conditions, the fact that people are displaced and living in squalor. But it also impacts on the ability of the health system to alleviate the conditions of those who contract the disease. There's no cure for polio, but if it's caught, then treatment can be provided to alleviate some of those worse circumstances. And in a situation where, as I say, the health system has been so decimated, the ability of that system to provide for these needs is severely limited.
Sam, I just want to ask you as well about the logistics of carrying this out, because you've got the zones, haven't you, where the immunisations, the vaccinations are taking place. Beyond those zones are the vaccination teams, the people who are bringing their children to be vaccinated. There's conflict going on around those zones while the vaccinations are taking place. Just explain for our viewers.
It's an incredibly complicated arrangement that's been negotiated carefully over the past several weeks, and negotiations on the details of the campaign continue on a daily and hourly basis. But essentially, the Gaza Strip was split into 3 zones for the campaign. In each of those zones, a safe area has been designated in which the parties to the conflict have agreed to pause in terms of hostilities for an 8-hour window from 6 a.m. to 2 p.m. each day. That is where the bulk of the vaccines are being administered. But there are lots of people who live outside of these quote unquote safe zones, and the ability of our teams to reach them in those areas, but the ability of people in those areas to reach the vaccination points is incredibly complicated. And this is why it's taken so long and it's so delicate, the preparations around the campaign. We'd have much preferred if we'd have been able to vaccinate the entire Gaza Strip in one block. That wasn't possible, so we're proceeding in suboptimal circumstances, but we remain confident that with the preparations that we've conducted, an interagency effort between the World Health Organization, UNICEF, and my organization, UNRWA, working very closely with health professionals, highly skilled and highly qualified health professionals on the ground. We're confident that we will succeed, but we won't know that until the campaign has finished its first phase. And then, of course, we've got to start again in 4 weeks' time, because every child needs to be vaccinated twice if we're to prevent the further spread of the outbreak.
OK, Sam Rose from UNRWA, thank you very much for joining us.